local, and letting you have your say. The Elias Macco Show, CJAD 800.
Yes, indeed. Back home and back on air. It is the third hour of the Elias Macco Show, and real great to be back behind the microphone this week after taking just a little bit of a week off, and it is our third hour. So let's get right into things here. A pandemic rough on everyone's mental health, especially young people. A new treatment option is hoping to change just that. Dr. Martin Gignac is on the line, head of psychiatry at the Montreal Children's Hospital. Dr. Gignac, welcome to the show.
Thank you. Good morning.
So we have got some great news when it comes to options for teens who are facing a mental health crisis. So tell us about this new option.
So we have developed a program where we're going to be able to offer intensive programs for teenagers and intensive therapy for them. We have been seeing a constant augmentation of teenagers showing in the emergency room in distress, especially presenting suicidal ideations. And this was predating the pandemic. But during the pandemic, there was a 35% increase in the number of teenagers that we were seeing coming to the emergency room at the Montreal Children's Hospital and throughout the province. So we decided to put together our effort to create this novel approach, which is an intensive treatment program of 12 weeks duration, where we're going to be offering individual therapy, group therapy, family therapy, and we hope to improve the well-being of teenagers who are suffering from mental illness.
So, I know you mentioned that it did go up during the pandemic, but you touched on the fact that it was going up even before the pandemic. What is happening when it comes to teen mental health here, Dr. Gignac? Why is there an increase? Is it tougher to be a teen in the 2020s than it was to be a teen in the 2000s or the 1990s?
This is a very good question. We haven't identified one cause for this constant augmentation. Certainly there's something going on in social interactions and distress that teenagers are going through. The pandemic had an impact on their capacity to use those skills that they were maybe keeping their heads above the water, like doing sport or belonging to an artistic group or being around with friends. That was all shut down during the pandemic, and it had a major negative impact on teenagers' well-being. So, of course, this was a concern that we were seeing in our work, in our daily work, and so we put our heads together and we came up with this novel program.
We're with Dr. Martin Gignac, head of psychiatry at the Montreal Children's Hospital, talking about a new program and a new center for mental health for teens. Another option when it comes to mental health treatment that has happened. Now, Dr. Gignac, it costs money to treat mental health. I know governments have promised, we're going to take this more seriously. We'll have funding. There seems to just be a dialogue now that's happening more than ever when it comes to mental health. But how did you fund this? Where did you get the money for a new Center for Teen Mental Health?
So you're right to point out that there is investment in teens' mental health that is happening right now in the network, and a lot of the new resources are going to the first line, which is great. However, we had identified in our own hospital a shortage of resources because the demands have increased, but the resources have remained more or less the same in terms of hospitalization beds. So we decided to approach the foundation and to seek support from community and donors, and we were able to raise $12 million in a 6-month duration, which is a great achievement, and we're very proud to have the support of the foundation and the donors, and we would like to thank them, of course, for making this vision a reality.
Dr. Gignac, when you mentioned, off the top, teens showing up that are, thinking about suicide or in such dire mental health that they're thinking about suicide, that was a punch to the gut, right? I'm thinking about teenagers, kids in high schools being in such distress. It actually, hurts the heart when you hear that. What's happening here? What should parents be thinking about? If they feel that perhaps their child is in that situation.
So we should always take seriously any comment about thinking about suicide. Sometimes it's not a real desire to die, but it's more like a cry for help, and it's a way to express our emotional distress. When we are teenagers, we might not have the appropriate tools, or we might not have the maturity to really seek out help. So we have to take those, I would say, verbalizations very seriously. And then it's our work as a mental health professional to distinguish those that have depression or mental illness that requires a psychiatric, maybe hospitalization and psychiatric treatment, and those that are in distress because of psychosocial stressors, things that are happening in their lives, maybe things that are happening in school. So within our program, we're going to do both, so addressing the mental illness issues, maybe treating with pharmacology sometimes, and we will also provide sufficient support to teens and their families, because we want to make sure that communication within the family will improve so that if ever there was another crisis of this type, at least they will have a safety plan in place, and the parents will know how to respond to this cry for help.
We're with Dr. Martin Gignac, head of psychiatry at the Montreal Children's Hospital, and we're talking about the opening of the Specialized Center for Adolescent Mental Health from the Montreal Children's Hospital. It's called Le Spot for short. So, Dr. Gignac, I know you can support up to 1,000 teens that are in this situation. Can you tell me, what were teens facing before Le Spot opened, and what does this change now that Le Spot is open? What are you hoping this changes when it comes to mental health?
So one thing we have seen over the past decade, I would say, is that we often had to hospitalize teenagers in medical floors because of shortage of beds. So we believe that we may be able to redirect some of them that are deemed to be safe and judged to be safe to go back home, knowing that there will be a rapid follow-up. One of the problems that we were facing before the opening of the spot is that we would refer those patients to first-line services, but there was always a wait time, a delay before they would be seen, and sometimes in some areas the delay can be quite long. So we were seeing a turnover of patients at the hospital, so some patients would be coming back within a month with the same complaint because they saw nobody. So we're hoping that we're going to be improving, that we're going to be using the resources more efficiently, and we're hoping that we're going to see an improvement in the turnover that we saw in the emergency room, so that patients, once they get seen and triaged and sent to the appropriate resources, they don't have to come back to the emergency room because the plan didn't take place. So we're hoping that it's going to change this pattern that we were observing for the past few years.
Helping adolescents aged 12 to 18. Is the funding secured long term here?
So we have the funding for the next 10 years, so which we believe is a good time frame in order to demonstrate that this is going to be proven to be a better use of resources, and hopefully it would become part of the of mental health programs across the province. So this is what we're hoping to promote.
Well, Dr. Gignac, knowing that the average wait time was to get community-based mental health service was 180 days. I imagine this is going to be a huge help in lowering those times.
Exactly. So we're promising that within a few hours, so 24 to 72 hours, depending if it's on the weekend or not, that we are be able to be offering a service to teenagers showing in distress in the emergency room. And also we're going to be providing a multidisciplinary team approach. So we have psychologists, we have social workers, we have an occupational therapist, we have a psychoeducator, we have a full-time nurse, and we have, of course, a psychiatrist who's going to be working with that team. So with this multidisciplinary approach, for a 12-week program, we hope it's going to be offering a better bridge between a visit ER and maybe after our intervention, a more long-term follow-up in the community, if still required.
The Specialized Center for Adolescent Mental Health of the Montreal Children's Hospital, known as Le Spot for short. Dr. Martin Gignac, thank you so much for telling us all about it.
Thank you very much for the invitation.